Prior to performing a head-to-toe assessment, introduce self and verify client's identity using agency protocol.
I'm going to be your nurse today.
Explain to the client
Can I have your name up there?
what you're going to do, why it is necessary, and how she can participate. Ask for permission to touch the client.
Just to make sure everything is healthy and working well.
Okay.
I'm going to have to touch you though. Is that okay?
Yes.
Wonderful.
Provide client privacy. Perform hand hygiene and apply gloves. Assess for alertness and orientation to person, place, time, and situation.
What date today is?
Today is April the 14th. I think it's a Tuesday.
Can you tell me where you are?
I am at the school.
And can you tell me why you're here?
I am here to do a head-to-toe assessment.
Wonderful.
Obtain vital signs.
I have to get your vital signs. Is that
Blood pressure, heart rate, respiratory rate, temperature, oxygen stat, and pain. For video purposes, we will not check the heart rate or respiratory rate for a full minute.
No.
You will also observe body build, height, and weight in relation to the client's age, lifestyle, and health. Observe overall hygiene and grooming. Observe for signs of distress. Assess the client's attitude. Note the effect and mood and appropriateness of the client's responses. Listen for speech, quantity, and quality. Listen for relevance and organization of thoughts.
count your pulse if that's okay?
Okay.
Inspect the skin for color, edema, skin lesions. Observe and palpate skin moisture. Note skin turgor by lifting and pinching the skin. Normal findings: the skin springs back to previous state.
I'm going to pinch your skin right here.
And deviations from normal: the skin stays pinched and tinted. Therefore, you will count in seconds how long the skin remains tinted, and this can indicate dehydration. Assessing the hair. Inspect the evenness of growth over the scalp.
Your hair, is that okay?
Inspect the hair thickness or thinness. Inspect hair texture or oiliness. Note presence of infections or infestations such as lice by parting the hair in several areas, checking behind the ears and along the hairline of the neck.
Do you mind turning so I can see your hairline? Wonderful. Thank you.
Perform blanch test of capillary refill.
Can I see your hands?
Press nail between your thumb and index finger. Look for blanching and return a pink color to nail bed.
Is that okay?
Count in seconds for the time for the color to return completely. Normal findings are less than 2 seconds. Assessing the skull and face. Inquire if the client has a history of lumps or bumps, itching, scaling, dandruff,
Any headaches,
loss of consciousness,
symptoms?
dizziness, seizures,
Take care of it.
headache, facial pain, or head injury.
Head injuries?
No.
Inspect the skull for size, shape, and symmetry. Inspect facial features for symmetry.
Can you smile for me? And then make a puffed out face? Good.
Inspect pupils for color, shape, and symmetry.
Look right at me.
Normal findings are black in color, equal in size, and normally 3 to 7 millimeters in diameter. Inspect ear canal and tympanic membrane.
Mind if I look into your ear canal?
Tip the client's head away from you and straighten the ear canal by pulling the pinna up and back. Normal findings are pearly gray in color and semi-transparent. Assessing the nose and sinuses. Inquire if the client has a history of allergies, sinus infections, injuries to the nose, difficulty breathing through the nose, or nosebleeds. Palpate the maxillary and front sinuses for tenderness.
Okay. Let me know if you feel any pain or discomfort.
Inspect the external nose for any deviations in shape, size, or color, or flaring. Inspect the nasal between the nasal chambers for midline. And inspect naval cavities
Wonderful.
using pen light for redness, swelling, growth, or discharge. Assessing mouth and oropharynx. Inquire if the client has a history of routine pattern of dental care, ulcers or lesions, teeth pain, cavities, or wears dentures or partials.
No.
Assessing cranial nerves. Cranial nerve 1. Olfactory. Smell.
Can you close your eyes and cover up one nostril for me?
Yeah.
Ask the client to close eyes and alternate closing the left or right ear between identifying different aromas such as coffee grounds and pepper.
Cough.
Wonderful. Can you switch nostrils?
Cough. Perfect.
Cranial nerve 2. Optic, vision, and vision fields.
Do you go to the eye doctor regularly? Do you use the eye chart when you go there?
Yes.
Do you mind if we do that now?
Okay.
Take you there.
Ask the client to stand 20 feet from a Snellen chart to test distant vision. Read the smallest line the client can see with one eye closed and alternate between eyes.
FBPLTCEO.
Wonderful. And can you close your eyes and put your hands out?
Yes.
Awesome.
Cranial nerve 3. Oculomotor. Extraocular eye movement. Assess pupil reactions and the 6 cardinal gazes.
No.
Assess the pupil's direct and consensual reaction to light.
I'm going to shine a light in your eye.
Okay.
But it's just going to be
For video purposes, the room will not be darkened. However, in real life, you'll want to partially darken the room. Ask the client to look straight ahead. Using a pen light and approaching from the side, shine a light on the pupil. Observe the response of the illuminated pupil. It should constrict. Shine the light on the other pupil and observe the response of that pupil. It should can also constrict, known as consensual constriction. Assess pupil's reaction to accommodation.
Can you look at my finger?
Hold an object about 4 inches from the bridge of the nose.
And back at my finger.
Ask the client to look at the top of the object and then at a distant object, such as the wall. Alternate between object and wall. Observe for pupil response. The pupil should constrict when looking at the near object and dilate when looking at afar. To record normal assessment of the pupils, use the abbreviation PERLA. Pupils equally round and react to light and accommodation. Assess the 6 cardinal gazes to determine eye alignment and coordination.
Perfectly still.
Stand in front of the client and hold a pen light at a comfortable distance, such as a foot, in front of the eyes of the client. Move the pen light in a slow, orderly manner through the 6 cardinal gazes. Be sure to direct the eye back to the center before moving on to the next. Cranial nerve 4, trochlear, extraocular eye movement and downward and lateral. This was assessed during the 6 cardinal fields of gaze. Cranial nerve 5, trigeminal, skin of face, nasal mucosa, anterior oral cavity, sensation of the cornea, and muscles of mastication. Have the client close their eyes and with a sharp object and a dull object, alternate areas of touching the face and have the client describe the touch.
And that's the soft side. Can you tell me me where you feel it and what you feel.
Okay. Sharp on my left cheek. Soft on my left chin. Sharp on my right cheek.
Due to video purposes, we will not be doing the sensation of the cornea. However, to perform this, you will have the client look up,
Can you clench your
lightly touch the lateral sclera of the eye with a sterile gauze to elicit the blink reflex. Ask the client to clench their teeth to feel the muscles for mastication. Cranial nerve 6, abducens, extraocular eye movement laterally. This was done during the 6 cardinal fields of gaze. Cranial nerve 7, facial, expression and taste. Ask the client to smile,
Can you give me a big smile?
raise eyebrows,
Raise your eyebrows up.
frown,
Give me a
puff
frown.
out cheeks, and close eyes tightly.
Thank you.
Cranial nerve 8, auditory, equilibrium and hearing.
Can you close your eyes for me? I'm going to ask you if you can hear sounds.
You can do the watch tick test or the Weber's test.
Let's see, something watch.
In which ear?
Left ear.
Sorry.
Something watch. Right ear.
Wonderful.
Cranial nerve 9, glossopharyngeal, swallowing and tongue movement. Ask the client to swallow.
Can you take a sip of your water so I can watch you swallow?
Yes.
Wonderful.
Ask client to move tongue to side and side and up and down.
And move it back and forth and up and down? Wonderful.
Cranial nerve 10, vagus, swallowing and uvula. Ask the client to say ah
Can you open your mouth and say ah?
and look to see if the uvula moves. Cranial nerve 11, accessory, head movement and shrugging shoulders.
Your shoulders and your head. Is that
Okay.
okay?
Ask the client to shrug shoulders against resistance from your hands,
Can you move your hand towards
and ask client to turn head against resistance from your hand.
Wonderful.
Cranial nerve 12, hypoglossal, protrusion of tongue. Ask the client to protrude tongue and then move side to side.
Can you stick your tongue out and back and forth? And you should get the resistance of your cheek. Good.
Assessing the neck. Inquire if the client has any thyroid problems, neck pain, or stiffness.
Any pain in your neck?
I do have a little arthritis in my neck, but I just,
Palpate for enlarged lymph nodes.
no,
Any infections right now?
no.
Assessing the thorax and lungs. Inquire if the client has the history of the following: asthma, smoking, coughing, wheezing, occupational hazards, tuberculosis.
Controlled?
Yes.
Wonderful. Are you
Inspect the shape and symmetry of the thorax. Auscultate with a stethoscope the vesicular, bronchovesicular, and bronchial.
and then listen to the back.
Okay.
Ask the client to take slow, deep breaths through the mouth.
Take a deep breath.
Yes.
Listen to each point to the breath sounds during complete inspiration and expiration. When listening to posterior, you can inspect the shape and alignment of the spinal column. Inspect breathing patterns, rate, and rhythm.
Would you mind sitting up for me?
Assessing the heart. Inquire if the client has a history of heart disease, including the family history, high cholesterol levels, high blood pressure, or history of chest pains.
History of high cholesterol.
Auscultate heart sounds. Due to video purposes,
I'm going to listen to your heart sounds in 5
listening to the heart will be done on top of the clothing. Listen for apical, pulmonic, Erb's point, tricuspid, and mitral, also known as apical. For apical, you will want to listen for 1 full minute. However, due to video purposes, we will not listen for 1 full minute. Palpate the carotid arteries, remembering, and very important, to only palpate one at a time.
Okay.
Inspect jugular veins for distension. Assess peripheral vascular system. Assess bilateral pulses, brachial,
Start with your wrist.
radial, femoral, popliteal, dorsalis pedis, and posterior tibialis.
There's one about right here that I need.
Okay.
You will also inspect the legs for redness and swelling.
One behind your knees that I need to feel.
Okay.
And then 2 on your feet. Okay. One on the top and one on the inside.
Breast exams. Ask the client if monthly breast exams are performed, and for clarification, ask the client if she knows how to do the self-breast exam and have her explain it to you.
When do you do it?
I usually do it in the shower. I do it one at a time.
Uh-huh.
Just raise my hand up and I start from my armpit area, working my way in towards the nipple in circular motions and looking for any bumps.
Assessing of the abdomen, and due to video purposes, we'll be assessing the abdomen on top of the clothing.
And that's fine.
Inquire if the client has a history of the following: nausea, vomiting, diarrhea,
Vomiting.
their last bowel movement,
When was your last bowel movement?
This morning?
Okay, good.
change in appetite, heartburn, or any surgeries. Inspect for distension
No.
and auscultate bowel sounds. Stethoscope would normally be on the skin, but for video purposes, this will be done on top of clothing. You'll want to inspect the lower right quadrant first, then the upper right quadrant, upper left quadrant, and lower left quadrant. After auscultation, you will palpate to detect areas of tenderness.
If any of this causes you any pain or discomfort.
Female genitals will not be assessed due to the video purposes. You will ask the client if she has annual pap smears and physicals
When was your last?
and last menstrual period.
And do you normally go to a GYN?
Yes.
When was your last pap smear?
About 6 months ago.
Awesome. Let me sit you back up. Okay.
Motor functions. Assess for range of motion,
Can you stick your arms out for me? And up and down.
grip hands,
Can you grip my fingers for me?
push hands,
Push.
plantar flexion,
Pull that. Do you feel any pain with any of that?
No.
Okay, I'm gonna do the same thing with your feet. Is that okay?
Uh-huh.
dorsiflexion,
Your toes, and then pull back towards you with your toes.
and gait,
Any pain with any
which
of
was
that?
done during the assessment of the Snellen chart. Be sure to place bed in the lowest position.
You tuck back in.
Ensure that the client has their call bell.
Here's your cowbell.
Thank you.
I'll be back to check on you in about.
Wash hands.
Okay.
But call me if you need anything before.
Okay. Thank you.
And most important, remember to document. If you don't document, it didn't happen. And notify the physician of any abnormal findings.